most of the women, they are not doing adequate physical activity. So the guideline is that every day we should, for a normal person, 30 minutes of brisk walk is
Okay.
essential, at least
Right.
5 days a week. So 150 minutes of brisk walk in a week is very
Okay.
essential for everyone. And for if somebody has a high blood pressure or a heart disease, then the recommendation is that at least 40 minutes of brisk walk all the
Hmm.
days of the week should be done. So some
Okay.
people, they are doing jogging, or they may be doing some swimming,
Hmm.
or
Hmm.
some like moderate intensity exercises.
Yeah.
So they can do it 25 minutes thrice a week.
Okay.
And those people who are doing like weightlifting or other such kind of activities, so these activities can be done twice a week only. So there's no
Okay.
need of doing excess. So
Excellent.
one thing I want to emphasize is that most of the women, they do less activity. And when we talk to women, I don't know about Pakistan, but in India, if we tell a woman to walk, she will say no, we do a lot of walking in the house, and we do cooking, and we do household work. So that is not brisk walk.
Ah,
So
that is
you
not.
have to spare half an hour to do a brisk walk, so that you get breathless enough that you can't speak with the person who is walking with you. And you should slowly build up the pace,
Okay.
reach a plateau, and then slowly cool down. Like suddenly increasing your speed is also bad, and suddenly stopping is also not good.
Hmm.
You
True.
should warm up, maintain, and then cool down. And also, like those who go to the gym nowadays, I don't know, do girls go to the gym in Pakistan?
Yes. Yes. They
Youngsters in
most
India,
most.
yeah, they are very fond of going to the gym in India. So there
Hmm.
is a group of youngsters who are not doing any physical activity at all, and there's another group who are doing excess. So they are also at risk. We see like in the news that a person was going to the gym for 2 hours and suddenly he collapsed.
Yeah, exactly.
So what is happening is that you should know how much is your limit. So because most of the gyms, they don't screen you for the risk
Hmm.
of having heart disease. So if you are having a genetic risk, or if you have any acquired risk, then you should set your limit lower down. So they while on the treadmill, so you
Hmm.
see the pulse rate, heart rate
Yes.
comes.
True.
So do you know what is the limit, like how much heart rate you should stop?
Hmm. I'm not sure about this.
Not sure. So I'll tell you that there's a formula: 220 minus age. So
Okay.
suppose your age is 20. So
Right.
20 minus age is 200. So
Oh.
200 is the maximum achievable, but you don't have
Okay.
to reach up to 200. So if you are just doing normal gymming to remain fit,
Mm-hmm.
60% of maximum achievable is good enough for you. So 60% means 120.
120. Yes.
So once your heart rate reaches 120, there's no need to push further. Suppose you
Hmm.
are planning to reduce weight, you are having obesity, or you are like want to become more fit, then you can extend it up to 70%, means 140.
Okay.
So
Right.
to go beyond 140, only those who are regular athletes, or they are going to participate in some tournaments, so for them you can go maximum up to 80%. So that is
Okay.
160. So
Right.
once you cross 80%, then you enter the danger zone. So you must remember that the relationship of exercise to heart risk is U-shaped. U-shaped means if you're not doing any exercise, your risk is highest.
Right.
If you start doing exercise, your risk will come down, 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 and then you reach a plateau. So if you continue to do exercise, your risk will be down, but it will remain static. But if you exceed the limit, then your
Hmm.
risk will again start increasing,
Hmm.
because the risk of having fatal events, they increase when you do more than your limit. So your artery can crack, clot formation can occur, and you can have a heart attack. or sometimes the
Okay.
rhythm problem can occur. Like some people, they may have arrhythmia after excessive exercise.
Mm.
And in winters, we should be especially careful because we should not go for walk or exercise early morning. So once the
Okay.
sun is up uh, and the day warms up, then you can go for the walk. And you should not go late evening also, because most of the cardiac events, they occur during the winters in the entire world. Maximum heart attack deaths, they occur in the winters. So if somebody goes for a walk early in the morning when there's a strong cold breeze, so if you do aggressive exercise, it can precipitate heart attack. So it may be because of you may not be having the fat deposit atherosclerosis in your vessel wall, but the artery can go into spasm. Like the artery can become suddenly tight. So in
Okay.
women, the incidence of other kind of like even with a normal artery, the
Mm.
coronary spasm can precipitate a heart attack.
Okay, that's really important. Otherwise, women or girls who are planning for a walk or gym, mostly they do it early morning or late evening. So now, as you have, told us that during winters,
Hmm.
it's like
Really.
high probability if you're going to do this. This is something very useful, and this is new as well.